Welcome back to another episode of School of Airway. Now to talk about ketamine in use on the acutely agitated, delirious patient. You used to be called the emotionally disturbed patient, now the patient with acute delirium. Alright, from drugs, intoxication, structural abnormality like a head bleed. Alright, so this patient had been brought in, not by ambulance, dragged to the ED by his sister, who got called up after this patient, who was part of a gang, got beat up. I'm not sure if it was initiation. He had been drinking with his friends and all of a sudden assaulted. He had so many lumps in his head. He looked like a cartoon, like, Looney Tunes cartoon. Non-cooperative, acting all thuggish, cursing the sister out who wanted to save his life to make sure he didn't have a head bleed. Alright? Uncooperative, flailing, kicking. Alright? You gotta remember, I made a decision to give ketamine, because I don't believe the initial reports that have been overly exaggerated, that's a contraindicated in traumatic brain injuries. I saw one limited Israeli study, and our own guys, our parajumpers in the military, give this to our own military men when they get agitated before a painful procedure like a chest tube, a chest dart, needle decompression, or a crike. Okay, so understand that. They also get given when they have horrible mangled injuries from burn and blast injuries. Alright, so they give it IM if they don't have IV access. Okay, so this patient, I gave him IM. It wasn't that big. You can give your dosing 3 to 5 milligrams per kilo IM. Remember, there's two concentrations that we have in our ED. Alright, I think one is the 50 milligrams per ml and the other one is the 10 milligrams per ml. Alright, you need to know this, because if you're going to give it IM, use the higher concentrated one. Alright, in this case, we gave it to him. He tolerated it. CAT scan showed no bleed. He was allowed to sober up. And it's amazing, after the ketamine of the 45 minutes to an hour, patient's more relaxed. You shook him. He was able to wake up, more cooperative, feel a little tired. Kept having to bother him every hour to make sure he's not vomiting, having a seizure, and acting better. Later on, able to sober up. CAT scans were negative for skull fractures, intracranial facial fractures, or C-spine injury, and he went home. Alright? So it works. It works in patients with suspected traumatic brain injury. And in this case, he did not get any hypoventilation or hypoxia. He did have inside LCO2 to make sure it didn't happen. Right. Just because the hypoventilation, hypoxia didn't happen, even with IM, I would later learn with other lessons, with other patients, it can happen. Please come back for another episode of the School of Airway.